Hi, this is Dr. Lin. Today we're going to talk about gout and arthritis. There will be three types of gouts that we're going to talk about today. And we're going to talk about the causes of different gouts. We're also going to talk about what ways to examine it to make sure you have gout or what type of gout you have or arthritis you have. And we're going to discuss treatments for arthritis and gout. A lot of patients, when they come to me, they have severe joint pain, especially finger pain, stiffness, swollen, couldn't move in the morning, severe pain, couldn't do any work, severe pain at the toes, swollen toes, pain at the toes, no range of motion at the toes, they couldn't walk because of the pain. And they have gone through medical doctors, rheumatologists, they have gone through physical therapy, injection, acupuncture, chiropractic, massage, even taking painkiller. Nothing worked. And the medical doctor told them that there is nothing that they could do, that they will have to live with the pain and die with the pain. And there is no cure and there's no treatment to this kind of thing. And all they do is stuff them with pills and medications, which give them tons and tons of side effects. A lot of patients, when they come to me, they have no other options. Because I'm their last hope. They have no other hopes. Because they're living with pain so long. Okay? I want you to know that there is hope. There's hope of healing. There's hope of total recovery. But it's up to you and me, especially you, to keep searching, finding out the right method to help you to get your joint pain and gout better. The first type of arthritis, we call it osteoarthritis. Osteoarthritis is associated with aging. When you're old, when you are 50, 60, 70, your hands start to have joint pain. And when you have joint pain around the joint, and you go take an X-ray, and you'll see there's a lot of how do you say this? Overgrowth of bones around the joint. And when there's overgrowth of bone shown on the X-ray, then we know exactly what it is, and we know it's an osteoarthritis. Because whenever you get old, a bone gets degenerated. When the bone gets degenerated, these we call it osteophyte or bone spur, they come out of the joint and start causing a lot of pain and discomfort. Okay. Not only does it cause pain, it also causes a little swollenness as well too. And also, if you look at the next film, when your bones get degenerated, there are cartilages around the bones and collagens. And when these collagens and cartilage grinding against each other, the surface, they become worn away. Cartilage worn away, and they become degenerated. And more degenerated they are, the more painful, the more stiff, the more swollen. And the swollen is because of the edema, because of the blood vessel that was broken, the capillary that is not working, that's broken, and the water came out of the joint, that's causing the swelling of the joint. Okay. The other type of arthritis is called rheumatoid arthritis. Now, rheumatoid arthritis is very similar to osteo. The rheumatoid arthritis does not come with age. People as young as 20s and 30 can have joint pain, can have swollen of the hands and feet. And the difference, one of the difference is that rheumatoid arthritis, you cannot see on the X-ray of any bone spurs. There is no degeneration of the bones. There's no, because you're still young. You're still young. Okay. Main thing is the inflamed synovial membrane, which is the membrane surrounding the joint, they're inflamed. They're inflamed because of a lot of different conditions. One of the main reasons why it causes inflammation is because of the autoimmune response. It means that the body's immune system is going so bad, it's going so low, that the immune system of the body is attacking their own finger joint, attacking their own foot joint, therefore causing a lot of pain, discomfort, swollen, even deformity. You see your finger become so crooked and you can't even use it anymore. Okay? This can be prevented. If you find out early you have arthritis, if you have any kind of pain, and you had it for maybe a year or so, or maybe a few months, it's not going away, and your joint is swollen, you got to come right away. You got to seek any kind of medical assistance right away before it becomes deformed. Because if you don't do that, if you don't find out that your immune system is attacking your joint, if you don't find out, it's going to get worse and worse and worse. No matter how many medication you take, if you do not find out the cause of the problem of the rheumatoid arthritis, then no matter how many medication, no matter how many injection, no matter how much drugs you take, it's not going to get better. Okay, now I'll tell you exactly how you should and what you should do to find out whether you have osteoarthritis or whether you have rheumatoid arthritis. It's very, very simple. Okay? The symptom of RA or rheumatoid arthritis: inflammation of the joints, we just discussed that. Morning stiffness, fatigue, muscle joint pain, bilateral and joint deformity. Now, one of the major signs of the RA or rheumatoid arthritis is that it's bilateral. It means that you have it both hands, you have it both knees, you have it both foot, you have it both shoulder or both elbows, or both wrists. Rheumatoid arthritis can cause pain at any part of the body, any part, not just the finger. But because the finger is much more, how do you say this, pronounced, you get much more symptom out of the finger. That's why more examples are shown around the finger area. Gout. Gout is purine, deposit of the crystal around the big toes. Over 90% of the gout symptom happen at big toes. And because of the deposit of the crystals. Now, the crystal is because you have too much purine in your body, and the purine level is not going away. The body is not excreting. It's not taking away the purines in the body. That's why it deposits in the joint. It could be at any other joint as well, but it's just most pronounced at the big toe. There's a lot of food that causes the problem with the gout or increases the symptom of gout, including alcohol, red meat, seafood, beans, and other more specific food we'll discuss later. Okay. Symptom of gout is same thing, very similar. The gout and arthritis is almost the same. Joint inflammation, swollen, redness, pain, fever, symptom usually at night, and in the morning, stiffness in the morning as well too. Okay. We just talked about the major differences, right? Let me say that again. Osteoarthritis, you can see it in the X-ray, and they are bone on bone spur for the osteoarthritis, bone on bones. Rheumatoid arthritis, there is no bone on bones. The bones are intact, the bones are great, the bones are looking great. But it's the synovial joint, the fluid that's inflamed, causing the swollen and deformity of the finger joint, of any kind of joints. And gout, again, is the deposit of crystals within the gout, causing erosion of the gouts. Okay, so these are the three major differences of the different type of arthritis and gout. Okay. There's so many different causes, which we will start discussing them one by one in more detail. Aging, of course, obesity, if your body is too much weight, too much fat, it's going to cause issue. Overuse, if you use your hand over for a long time, yes. Muscle weaknesses, if your muscle is too weak, you couldn't protect the joint. Drug interaction, and there's much more. Okay. Now, drug interaction means that there are a lot of side effects. Let's say, for example, you're taking cholesterol medication, or you're taking any kind of anti-cancer medication. A lot of these medications they cause side effect, which causes joint pain, which causes inflammation of the joint, which decrease our immune system, and our immune system start attacking the joint. A lot of it is coming from the drug interaction. So if you're taking more than 5 or 10 different medications, please look over the side effect. Please discuss that with your medical doctor, whether it is causing joint pain or not. Very, very important. If you do not take away the effect of the medication, no matter where you go, no matter what treatment you seek, it's never ever going to get away. Even you have surgery, even you took the joint out, still in your blood, it's still going to cause, we call it phantom pain. Okay, phantom pain means if there's no joint, there's pain. Okay. Like I said, the primary issue that causes the joint pain, especially the rheumatoid arthritis, is the autoimmune system. Now, autoimmune system can also attack your joint because of osteoarthritis. It's also because of the gout. It can also affect those as well too. Any type of arthritis, it can affect it by the autoimmune system. Autoimmune system again is bacteria, viral, parasite, germs, toxin, viruses, pollution. All these outside environment come into the body because the body is overwhelmed with all these bad stuff, and body can no longer attack these bad stuff, and for some reason the body is mutated, the gene mutated. The white blood cell no longer recognizes these as foreign substance. It recognizes your joint or your toes or your whatever joint in the body as a foreign substance. It starts to attack them. That's why you have pain, that's why you have swollen, that's why you have all these bad symptoms. Okay, so we gotta deal with this. We have to deal with the autoimmune issue, because if you have autoimmune issue, your finger joint is not the only stuff to go. It's not. Your brain, your thyroid, your blood, your gut, your nerve, your lung, your skin, your muscles, everything is affected. And then the entire organ, not only just the organ, but the spine. Your immune system will attack all the other area of the body, and you're going to suffer. Not just the joint pain, but pain all over. They call it fibromyalgia. See, all over pain. And you have fatigue, and you have, dizziness, and everything. And I'll tell you exactly how to find this out. Please continue. Inflammation is one huge things that causes the joint pain. Okay, inflammation comes from where? Sugar. Majority of inflammation comes out because of the sugar issue. Too much sweets. Okay, why? Please go on the internet. Type and research yourself how does sugar increase inflammation. Okay, you'll see. Because clinically we have seen a lot of patients when they take way too much sugar, the joint pain just comes on, and there are pain with people with pain that's on and off. Pain for 1 minute and it goes away in an hour, another come back again for another few minutes and goes away in an hour. Just on and off, and just day by day, year by year, just like that. And for no reason, the pain with joint will swell up like a balloon. And for no reason, after a few days, the joint pain goes away. Why? Because the majority of the issue is also caused by the food, the diet that we eat. Diet, that's very important. So we gotta be careful if you want to get a total healing, if you want to get a treatment for anybody. Okay, your food has to be a part of the healing process. Has to be part. Nightshades. Nightshade cause inflammation. Okay, such as peppers, eggplant, tomato, green pepper, bell pepper, potatoes, and there's others. This is just one of the few major ones. Okay, so avoid these by all means. Avoid these. Sometimes if you just by avoiding these food, you are going to get a miraculous healing just by avoiding these diets. You'll see. If you don't believe it, you'll see. Try it out yourself. Toxicity. Now we're living in a toxic environment. I call it toxic soup. You see the soup, there's industrial toxin, there's oil toxicity, there's medication toxicity, there's alcohol toxicity, there's drug toxicity, and there's the garbage toxicity. We are all swimming in the toxic soup. There's no way to get around it. There's no way to get out of it. Okay, that's the reason why of all these toxins is causing our immune system to not working, and therefore causing severe joint pain. Toxicity. Okay? Like I said, bacteria, fungal infection, viral infection, parasite infection, okay? All these infections. Now if your immune system is strong, our immune system has the ability to attack and kill and eliminate these issues. But if your immune system is low, these, when they come into your body, will also attack your joint and causing a lot of pain. Okay. pH is a huge issue because again we're living in a toxic world. A toxic world are just full of acidity. For example, hamburger, the bun, the meat are acidic. Candies, bread, pasta are acidic. Red meat are acidic. Okay? The only alkaline food is vegetable, which most people do not eat green vegetables. Okay, so you gotta have a balanced diet. Gotta make sure that your pH level is okay. If your pH level is way up here, very acid, then you're gonna have a lot of severe pain that nobody will be able to take care of unless you take care of the pH level of the body. And very simple. You can just get a little tag, put in your tongue, test it under urine, or sometimes even the poop, or some of the blood. You can find out if your pH is high or low or middle. Okay, it cannot be too low. It has to be in the middle range, which is about 7. If your pH is about 7, for some patients, there are some patients, even just controlling the pH, the pain goes away. The muscle pain goes away. The joint pain goes away. Okay. Deficient in nutrient. Our patient said, when I see some of those patients and I test them and I told them you're deficient in a lot of different nutrients, and they told me, we eat healthy, we eat the food, everything we eat, the market, and we cook ourselves, but why are we still deficient in nutrient? Okay, one of the major causes of the nutrient deficiency is our soil. Our soil, if you imagine that, the soil now compared to soil 100 years ago, there is no nutrient because it's been soaked with a pesticide, been soaked with chemicals, it's been soaked with chemical preservatives. Okay, and not to mention the pollutions. Everything has been soaked under the soil. If there's so many toxicity in the environment, do you think the soil will retain as much the nutrient as it used to be? No. So the nutrient of the food that comes out of the soil now, it's about 10% compared to 100 years ago, it's about 100%. That's why we're so missing the nutrient. That's why our body cannot get the nutrient, our body cannot heal. We get tired, we get fatigued, we get joint pain. The body cannot heal because the body does not get the fuels that it needs to process, to function. Okay, that's why having a good food is so important. Having a good diet is so very important. Okay, enzyme digestion. How does that relate to the finger? Yes, of course it does. If let's say you eat the food comes into your mouth, pizza, whatever it is, hot dog, comes in, and there's no digestion, there's no enzyme to digest the food. The toxicity of the food, or whatever junk is of the food, is going to stay in the stomach. It's going to produce a lot of bad bacteria, right? Fungal, parasite, bacteria, virus. It's going to be produced in the stomach, and all these infections is going to go into the joint, finger joint, whatever joint in the body. It's going to start attacking those joints because your stomach did not process them. The stomach does not eliminate these stuff. Okay, that's why digestion has to be good. We gotta poop every single day. Okay, we gotta have enough enzyme in our system to digest all that stuff as well too. Okay, lymph circulation and also the blood circulation and drainage is another major issue because let's say if your body is able to eliminate, to kill the germs, bacteria, infection, but it has nowhere to come out. Let's say your blood circulation is not moving, your blood is not moving, stagnant. Your lymph circulation, your lymph it's not moving. Your lymph is like the lymph system is like a water pipe in the house. If your water is clogged, right, your toilet, your sink, it doesn't come down because of the clogged pipe. Okay, our lymphatic drainage system is like a piping system. Okay, if the lymphatic is clogged up, all the junk cannot come out of the body. The circulation, if it's so stagnant, the blood's so thick, the junk cannot come out of the blood, therefore causing a lot of joint pain, muscle pain, whatever pain. Okay, this too has to be fixed. Major. Okay, now trapped emotion, trauma, stress, they all add up to, to pain. Because when you have stress, when you have a lot of stress, our organ function comes down, our immune system goes way down, our blood circulation stops, our lymph circulation stops, our body ability to process the toxin and sugar and food stops. Everything stops function, and the cancer grows. Okay, and there are cases where people that have cancer and they go on live a stress-free lifestyle, and just by living in that kind of lifestyle, the cancer goes away. I mean, not everybody, but there are some cases which reports that way. So you can see how strong the emotions, how strong the stresses of our daily living can affect the function of the body. Another issue that may have caused joint pain is the electromagnetic field. Electromagnetic field comes from cell tower, cell phone, iPad, computer, way too much TV. These electromagnetic field not only does it affect us, but also affects the whole entire Earth. Because our Earth is filled with, the cell phone tower. Everybody using cell phone nowadays, right? It's affecting the bird in the sky. It's affecting the bee population. It's affecting the insect population. If you look into more research, the bee population has gone down about 60%. And just imagine that another 50, 100 years, the bee will be extinct because of the technology we have. Our body produces a natural forces, energy, and this energy is also because this energy has interconnection with the earth energy as well too. Okay. Now, when these natural energy are affected, are interrupted by either X-rays, radiations, sun radiation, infrared, ultraviolet ray, cell phone tower, computer plugs, all these can affect our natural energies. Okay. When these natural energy affected, our body start to go haywire. The function of our body start to go down. Okay. So that's the reason why it's very important that we look into this matter. There are ways to test it to know if your energy has low. If your energy is low, we gotta make sure we add it in. We replenish the good energy that you're missing. Okay. Your nervous system. How does that relate to the pain, the joint pain you have? Of course it is, because your nervous system, from the brain all the way to the spinal cord, each different spinal cord are responsible for each different type of organs. For example, the lungs affected by T1, T2, your liver is affected by T9, T10, your bladder is affected by L2, L3, okay, your heart is affected by T3, T4. And your neck and your arm is affected by C5, C6. Okay, so let's say if your organs are affected, right? The function of the organ, let's say for liver and kidney. Liver and kidney is to detox. If your body cannot get rid of toxicity, the toxin remains in the body and goes to the finger and the toe, causes severe pain, right? If the stomach cannot function well because of the spine issue, nerve issue, body cannot digest the food. The toxin goes to the finger. If you cannot regulate your circulation with the heart issue, the blood circulation cannot drain the toxin out of your body. Therefore, the pain, all the junk goes to the finger and the toe. Because the body is like a body of network. A network. Everything interconnects. Everything works with one another. If it's one little thing missing, or one little thing that's not working, it's going to affect the entire body system. So we're looking, when we treat the arthritis, when we treat the joint, any kind of pain, joint pain, we have to look at the whole system. We cannot just treat the fingers. We cannot just treat the toes. We cannot just treat the shoulder. We cannot. It will not work, because if you only treat that, if you only do a localized physical therapy, localized injection, right? Yes, you get that better. Temporarily relief, but the pain comes back. Always come back, because your body is not being fixed. Your body is still not working. Of course it's going to come back. Okay, so we got to fix your nervous system. We got to make sure your joints are fine, are doing well. Your brains are doing well. All the nerve neurons are flowing nicely. We've got to make sure of that. Okay. Now, food allergy, that's a major issue. Whenever I talk about allergy, people always think skin allergy or allergy with coughing or allergy with sneezing, pollen, cat and dogs. But no, but food allergy can cause a lot of major pain. Major pain from the food. If you eat the wrong kind of food, your finger will swell up like a balloon. If you stop eating that kind of food, the finger gets better. Okay? Nope. Patient comes to me, I explain these. They don't believe it. And I tell them, go prove it. Stop eating this diet, see for a week. And I'm right every time. Okay? And after that, they believe it. They come to me for more advice. Okay? Now, we gotta find out what food is bad for you, what food causes the pain to the finger and the toe. We gotta find that out. It's very important we do that. Okay? Now, the reason why I put these out, because these food most of these diet is either genetically modified or it's going to be modified. Okay? Which tomatoes modified? Why they're big, huge, right? Cotton modified, alfalfa modified, rice not yet going to be. Wheat modified, corn's modified, sugar beets modified, squash is modified, salmon going to be, not yet. Okay, soy for sure, canola yes, yeast yes, peas yes, Hawaiian papaya is also modified. Okay, so think about all the modified food that we're eating. All these are genetically modified food. If we eat these food constantly, don't you think our body is going to get modified as well? Our body will no longer be now our own body. Our own immune system is going to start attacking our body because we're eating all these foreign substances. Doesn't it make sense? Okay, so we got to eat the right food. Get the right, go to farmer's market, get the organic grown food and start eating those food. Okay. Now, refer pain, it's another issue because when patients have joint pain, let's say finger pain. A lot of patients when they come to me, they have this, thumb, they couldn't move their thumb, right? And they call it trigger thumb because the thumb stuck here and they can't move it. If they want to move it, they have to force it down and click and then when they extend the thumb, it's stuck again. Okay, what do you call it? Trigger finger. And when you have these kind of finger, we gotta also not only are we looking to the joint, we'll also look at the refer pain because if you look at the spot here. The area that refers to the thumb is C6. Okay, if you have issue with these two fingers, it refers to C7. It's C7 here, our neck here. If you have issue with the last two fingers, it refers to T1 of our spine. Okay, so there is a relationship of the spine in connection to the finger pain as well too. Okay, not only just pain, it could be numbness, tingling, spasm, whatever it is. We have to look at this as part of our treatment as well. Chinese medicine theory, this is one of the major parts that we look into it as well too, whether your body energy is not working, whether your meridian system is not working, whether your body has too much wind, too much qi, too much dampness, your qi level is not good enough, your blood is not doing well, fluid in your system is not going, your yin-yang is not balanced, meridian system is not balanced. All these issues has to be looked at. It helped us to heal the body faster, better, and more efficient. Okay, so we have to look at it into this Chinese theory as well. Okay, brain function, we talk about that. Now, if the brain is not working, like we say, it affects our emotion, our sensation, our behavior, our balance. Not only does it affect these mood problems, it also affects all the nerve system down to different organs, right? The brain also controls all the muscle, the nerves, right? All the tendons and ligament because it sends impulses to our hands, our feet, so we can move, so we can walk, so we can lift, so we can work with our hands. It's all because of the brain. Brain is not working, the hand will not work. Simple as that. So to treat the finger pain, we also look at the brain. Okay, the brain is divided into more specific function. We call it delta, alpha, theta, beta waves. Now these waves, we have to look into it to make sure they're working well. If they're not, we gotta fix them in order to fix the finger as well too. Okay? And there's neurotransmitter. A neurotransmitter, if you look at the neurons, these are the neurons within the brain. If the neurons are not connecting with each other, if the signal within each neuron is not transmitting enough, is not transmitting sufficient messages. Okay, these neurons we call dopamine, serotonin, dopamine, acetylcholine. There's more. This is just an example of it. Okay, if these stuff is not being transmitted from one neuron to another, there is no connection. When there's no connection, our finger will not work. Our finger will not heal. Our feet, our ankle, our toe will not heal. Okay, so we gotta look into this as well too. Now, methylation, that's a major issue also. DNA, RNA. There will be other doctor or medical doctors saying that you have arthritis because your parents have arthritis. Your mother, your grandmother, or your grandfather has arthritis, therefore you have it. There's nothing they could do. Okay, there's a way to find out if your genes has issue with that. If it does, there are ways to recover that. There are ways to recover that. There are ways to basically help you improve these conditions. Okay, this is called methylation. Okay, and we'll discuss what we do that we can find out that the gene issue for you as well too. All right, we talk about the connection. Okay, the body has to be connected in order for the organs, the joint, everything to work. Okay, so we just talk about layers. So whenever a patient comes in with finger joint, with a toe pain, wrist pain, thumb pain, never ever just one reason. Always multiple layer of issue, just like the onion. Multiple layers. We gotta take away the layer one by one. Layer of inflammation, layer of toxicity, layer of EMF, layer of the food issue, layer of the sugar issue, layer of the the nerve issue, layer of the organ issue, layer of the circulation and fatigue issue. Layers upon layers upon layers upon layers of issue that's causing the pain. Once we take out the layers away, the pain is gonna get better. The pain is gonna go away. Are you gonna live a pain-free life? Okay. X-ray, MRI, bone scan is one of the three best way to find out what kind of joint pain you have and what happened to the joint. Okay. If it's just X-ray, it will not be enough. If it's only the MRI, it will not be enough. Has to be all three. All three has to be done. Bone scan is optional, but these two has to be done. Okay. Now, if you have gout, how do you know? So we send you for blood tests and test for purine and serum urate level. If it's not normal, then we know you have gout. Okay. Or we can, X-rays you can see, or MRI can see as well too. Okay. We're also going to send you for a blood test for inflammatory panel. RA factor, NA, latex, ESR, uric acid, anti-DNA, C-reactive protein, sedimentation rate as well. These are inflammatory process that we gotta get these done to know whether you have inflammation or not. Okay, not just you go to a medical doctor, he look at your finger and he say you have inflammation. Yes, what kind of inflammation? Okay, what kind of inflammation determine what different treatment that you need. Okay, sugar. Okay, we gotta make sure we get this tested. Blood sugar, HbA A1C. If you have this high, for sure you have diabetes. Okay, insulin antibody, glucose tolerance test. Now we have a lot of diabetic patients that come in with severe joint pain, and it's because of the sugar level, which is way too high. Even though they're doing insulin shot, even though they're taking sugar medication, still because these medications have side effect, causes joint pain. We do electrolyte panel to make sure that your body has sufficient nutrients. Okay, whether you have sodium, potassium, calcium, magnesium, vitamin D, phosphorus, lactic acid, and blood pH to make sure your body has sufficient nutrient. And we test your autoimmune panel. We talk about that immune system. If it's not working, it's going to attack your own joint. We're going to test for IgG, IgM, IgE, IgA, interleukins 1 to 12, T helper cell, CD3, CD4, CD8. We also test natural killer cell, We also do C3, C4 complement testing. Okay. Now this is the methylation test by the professionalcoop.com. You go there, get this done, and it's going to test all these gene issues. If you have issue with the genes, there are ways that we can help you to solve this issue as well too. Okay. This is one of the best way to find out what's going on with your blood. So what we do, we take 1 drop of blood, put it under a microscope, and we'll look at the blood life. Now, the blood is the normal, beautiful blood is going to be shown like this. You know, red blood cell is going to be individual. If your blood is clogged up like this, then we know there is issue that your blood is not moving. Okay, your circulation is very bad. Okay, or you're eating something you're not supposed to do, to be eating. If you have a lot of crystals, we know you have gout, probably. Okay, if you have a lot of infection, which is affecting the red blood cell, either bacterial, viral, parasite, it's all going to show on the blood as well too. Okay, this is one of the best way that we do here. We also do pulsing system. So what we do is we pulses your pulses right in the wrist here, and we determine whether you have fire, wood, water. You know, we determine if you have issue with the meridian system. We determine whether your body type is hot, it's cold, it's warm, it's windy. You know that. Okay, we do that as well too. So why am I different? People come to me, they have been through all the medical doctors, all the specialists. They ask me, they couldn't fix me. What makes you different? How can you help me? How are you different? What makes me believe that you can help me? Okay, you have just gone through all that. Okay, there are no medical doctor in the world is going to do all that for you. It's going to check all that for you, but I will. Okay. Now, what I do differently is that I look at the diet, the food. Like I said, the diet. If you have the right diet, is 30% of your healing. Okay. So I will find specific diet that you can or cannot eat. Once your body has a right diet, your body heals. Okay. So I will tell you to do juicing. Juice is not just fruits. No, we don't fruit juices. We do vegetable juice. Vegetable juice is highly nutrient. And of course, I gotta tell you to buy the right food. You can't just put whatever you want in the juicer. You cannot. Okay, has to be a selected amount of food in the juicer to give you that boost of energy that your body needs. Okay. I use a lot of food supplements. Why? Because nowadays the food has no nutrient. So we gotta give you a boost of food supplement. These supplements are made from real food. They dry up the food and they grind the powder and make it into tablets and you swallow them. And all these are organic food. And when you start eating these food supplements, your body gets nutrient. Your body gets enzyme. Your body gets the antioxidant. The body will recover. The immune system is going to come up. Okay, that's why we gotta use this one. It's very, very important, especially the first few months. Okay, so after the first few months, you'll get better. Everything's healed, no pain, and you don't have to continue this. You don't. If you want to, you can. It's easier. But if you don't want to continue with the supplements, I will tell you exactly what food you should and should not eat, and just continue with the diet. You're gonna live a pain-free life all the way to the end. Okay, homeopathic and herbs, we do that a lot to take away inflammation, toxicity, bacterial, viral, fungal, parasite infections. You know, it's a lot of different usage for herbs. Now, herbs are very strong and they're very, very effective, and you'll see incredibly fast result with the herbs. If you do the right herbs, the speed of the healing will not be less than the medication. It will be just as fast, just as effective if you find out the right herbs for the body. Okay, and most of all, no side effect. No side effect. Okay, now if you have severe pain with the joint, we use this one, hot laser, to heal the joint pain. We also use a low-level cold laser to heal the joint pain as well too. Okay, laser is an incredible invention where it goes into a finger and start healing the joint. If you have osteoarthritis, if you have wear and tear, the laser is gonna heal it fast. Okay, if you have inflammation, swollen, the laser is going to reduce it, drain away the inflammation. It's really, really incredible machine. Rife machine, we use that to take away the inflammation, increase circulation. It depends on the frequency that your body needs. If your body have infection in regards to fungal, we find out the right frequency to take away the fungal infection. Okay, Rife has so many different frequencies that we can use to help with so many different conditions. That's why we use a lot of Rife here. Okay, now detox. This special machine, HIFAMAT, is used to take away the toxin in your finger, in your body, and drain it out to your lymphatic system. So your body can pee the toxicity out, your body can poop the toxicity out. Okay. Electromagnetic field, we talk about the bad energy, right? The cell phone tower, the TV, the radiations, it's all around us. One of the only way that to recharge your body is to use it PEMF, electromagnetic field therapy. You put this on the body is like a battery. The body absorbs whatever it comes, right? Bad energy or good energy. So once we give it a good energy to the body absorbs it, you will start detoxing the bad energy away from the body. Okay, you get more energy, your cells get energized, cells start to function. Your white blood cell, when it's energized, it starts to, attacking the right infection. It will not attack your joint. Okay, so this is very, very important and it's very effective in fighting against joint pain. Hakumat is another new invention that's specially made to heal joint pain. Okay, finger joint, foot joint, whatever joint. And if this joint is particularly affected by fluid issue, by issue with the nerve issue, this is an absolute godsend because people get amazing results. Usually within a few visits, people feel the relief. Amazing. Okay. Another machine is called Aquaroll. If you put your foot in there, your head in there, and this machine just massages and for some reason just relieve the pain for you. Amazing machine as well too. Okay. Now this rebuilder, if you have issue with the foot, with the hand, has a lot of numbness, tingling, joint pain, muscle pain, then we use this rebuilder machine to take away all the peripheral. We call it peripheral nerve issue, nerve affected pain. If there is no nerve pain, if your finger pain is not caused by nerve, this is useless. Okay? So of course we give the right therapy. It depends on the condition, depends on the layer of issue that you have. We give the right therapy. Now this is a DRX 9000. If you issue, let's say if your foot pain, okay, your toe pain is a result of a herniated disc, which the pain shoots from the lower back all the way down to your toe, the big toe. Then we gotta fix your back. If your thumb pain is caused by the neck C5, C6, then we gotta use this machine to heal the disc. Once the disc is pushed in, the nerve is no longer compressed. When nerve is not compressed, your finger gets better, your toe gets better. Okay, that's called referral pain, that's called nerve pain. Okay, but we gotta do a thorough check to see whether you have this condition or not. If you do, you gotta get on the machine and start and get the treatment. Okay, another great piece of equipment, wonderful, wonderful equipment. Okay, now ultrasound, we use this machine to heal any kind of muscle, ligament, tendon related issue, because if you have a lot of joint pain, the muscle, the ligament, the tendon, the collagen that surround the area is going to be so spasm, so tight. The ultrasound machine, the stimulation machine is going to help to reduce the pain, increase circulation. Okay. Now there's different mode in differential, Russian, high volt, pre-mod. Different modes is used to treat different conditions. Okay, so we would choose the right mode to help you with the conditions. Okay. Now this is called rapid release. What it does is, let's say if you use your thumb too much, if you pick up a baby too much, if you use mouse too much, if you constantly was moving, moving boxes, same kind of movement all the time, and you have severe pain in the thumb or in the wrist, and you have a lot of adhesion building up in the joint area, this machine is especially made to take away the adhesion, take away the spasm real fast and very, very effective. Okay, so especially used for spasm, muscle spasm, tendon spasm, ligament spasm, and also adhesion. Very effective as well too. Okay. Now, orthostem, we use this one to do adjustment. Spinal adjustment, head adjustment. Adjustment means that we're doing a spine correction. When spine is in the right correction, when the spine is in the right alignment, we mentioned the nerve goes out to your organs. The nerve goes out to your hands and feet. The nerve goes out to your muscle. It innervates the body, so the body functions normally. Okay, but it starts with the spine. Spine has to be aligned properly. Okay, neurofeedback, why? Because if your finger is affected by the brain, if there are non-connection, there are issue with the connection issue, the brain cannot send the message down to the finger joint. The brain cannot send message down to the toe, causes pain. Then we gotta use neurofeedback to fix the brain. Okay, the neurofeedback will clear the neurotransmitter issue, will clear the brainwave issue. Okay, and the computer will tell us exactly where we should put the placement. And we have a specialized scanning machine to help you determine what's going on with your brain. Okay, stress reduction technique. Like we talk about, stress causes a lot of different pain, right? Stress, trauma, your work, your life, your children, your family, your money issue. The stresses with your health. It's all getting to you, and you're feeling trapped. You don't know where to go. You don't know who to help. You don't know who's going to help you. You can't trust anybody. Okay, you don't know who to trust, and all this stress adding up is getting more and more pain, more of a vicious cycle. All right, and this is what we do. We have a stress reduction technique. We have several techniques to help you reduce the stresses, or to help you find out and pinpoint. Let's say the stress level is coming from your mother. The stress level is coming from your money issue. The stress level is coming from, when you were a child. Okay, abuse. Once we find out the stress, we take out the stress, your body gets better. Body heals miraculously when the stress goes away. Okay. Now, if you have an issue with the meridian system, we have a special machine that help you stimulate the acupuncture point, so the body yin yang is balanced. The meridian is balanced. The body heals along together with other therapies. Oxygen therapy is to just kind of give it an overall general health to make sure your body heals faster and better, because our cell needs oxygen to heal, right? Okay. Now you have seen all that. I'm sure your confidence in me has increased more. Okay. If you are interested in coming to me, we offer a free consultation. Now, free consultation, provided that you watch all of this. If you don't watch any of these and you come to me, we'll charge you $120 for consultation. We'll charge you. But if you watch it, if you understand what's going on here, if you know exactly what we offer here, our consultation will be free to you. You don't have to pay anything at all. Okay? So let me explain how we do the consultation. No, before that. I want you to first of all imagine, before you even come to me, before you even see anybody, before you get any kind of treatment, imagine that you are pain-free. Because it's possible. Because remember at the beginning I told you have hope. Once you have the hope, you'll find out the way. Once you find out the way, and you know your body is going to get better. Once you know in your brain that you're going to get better, you are going to achieve that goal. Okay, so I want you to do that with me right now. Imagine you wake up in the morning and there's no pain. The finger is moving so nicely. Your toe is moving around nicely. And you move around your shoulders and your knees. There's no pain, absolutely no pain, no restriction. Imagine that. Imagine you get up in the morning and cook for your family, cook a breakfast for yourself, and you're cutting food, and there's no pain. and you don't have to struggle with the pain, bring stuff coming out of your fridge. You don't have to struggle with, cleaning up the tables because there's no pain. Imagine going out with your family, your kids. Imagine holding the babies. Imagine enjoying the life, the pain-free life, and go out, enjoy the sun, enjoy the yard. Imagine you can drive around the neighborhood, going around to the market, going around to different places to visit, and your family is happy and you're happy because you have no pain, you have no joint pain. And you can drive because your finger, your foot no longer stiff. You can drive anywhere you want, like when you're 20 and 30s. Imagine going to a vacation spot and you're laying there enjoying the sun and you have no pain in the finger, no pain in the joints, no pain in the foot. And you can walk and run anywhere you want. Okay? Imagine you can play tennis, you can jog, you can climb the mountains, you can hiking, you can go playing golf, all pain-free. Okay? Would you want that? If you want that, give us a call. Come for the consultation. Okay? And the consultation goes like this. First, you came in, we give you a full history. We take the full history. We do some exam. Okay? And then if you need any kind of prescription for blood tests, for MRIs, for bone scan, whatever it is, or you need to do some blood testing, the 1 drop of blood, or you need to do some brain testing, brain scan, we'll let you know. Okay? Once you did that, okay, you take the prescription, you go home, you go get the x-ray done, you get an MRI done. After a few days, you come back with all the reports, with your medication reports, with the MRI report, blood report, brain report, whatever report you have from other doctors. Bring them in. I'll go through all that with you. I'll discuss all that with you. I'll discuss all the possible layer that may have causes your joint pain. And then I will discuss the option for care. How long you need to do, how much it's going to cost, I'll discuss all that with you. When you come in for this free consultation, I want you to bring your significant others with you. Your spouses, your another partner, whatever it is, bring over because they need to know your condition. If they care for you enough, they will come. If they're working, have them stop working for that day and come with you. The reason why I stress that is because you're living with pain so long. Your finger has started deformed. Your toe painful, so painful you can't walk. You can't cook, you can't do house chores. Or you can't work because of the pain. If your wife, your husband, or your partner care for you enough, he will come. Okay? If he doesn't want to come, he doesn't care for you. If he doesn't want to come, he doesn't care for you, you are going to have struggle in healing. You're going to struggle. You won't heal because you have no support. You gotta have your family support. You gotta have whoever is with you support you in your healing, in your taking the right diet, in taking the right supplements, in coming for the visits. If you come by yourself and you wanted the treatment, you start with the treatment, your partner is gonna complain. He's gonna complain saying, "Oh, you spend all this money for nothing." They're gonna complain you're taking all the supplements, waste their money. They're gonna complain you come for the treatment so many times. They're gonna complain, and you're gonna stop. And you're never ever gonna heal. And you're gonna lose hope. And you're gonna be depressed. And it's like a downward spiral. Okay? So whoever live with you have to come with you. Have to come with you. When you come for the consultation, please bring all the supplements. I need to know whatever supplement you're taking. I need to know your medical reports. I need to know all the medication you're taking. I need to know as much information I need to know. Just bring all to me. I want to see them all. Okay. Now we do not accept every single patient. If you drink, if you smoke, we don't take you because they just don't get better. Because even if we treat you, we're taking away all the toxicity, we take away the inflammation, we toxic all the junk in the body. At the same time, you breathe in more junk. At the same time, you drink in more alcohol to contaminate your body more, to affect your nerve and your joint and your cartilages and your synovial joint. Okay. There's no way. You're not going to heal unless you're determined to quit. Quit first. Okay, come in to we have a program that help you quit smoke, help you quit alcohol. We have the program like that. Come in, quit that, and then once you quit, then we can start heal you. Then you're gonna see healing. The pain's gonna be gone. If you're taking way too much medication, 15, 10 different kind of medication, it's gonna be very hard for us to help you. It's gonna be very, very hard. Okay, so when you come, let me know. We'll help you discuss. Maybe you can discuss with the medical doctor what he could do to help you modify some of the medication you have. Okay, but the medication has to be dealt with the medical doctor, not with me. I have no authority over medication. Okay, now if you're not willing to control your diet, if you come in and you don't want to take supplement, you don't want to stop eating certain food, I cannot help you. Do not come in, because if you're not committed to help yourself, I will not be able to help you. You are responsible for your own body and your own health. You are the one that heals yourself. If you don't do it for yourself, nobody can help you. Nobody. Everybody asks me about insurance issue. We don't know how your insurance coverage is unless you bring us the information. Or you could over the phone call us. My assistant May, she's going to help you determine what kind of coverage you have, whether you have coverage or you don't. Okay, if you don't have coverage, it's out of your own pocket. Okay, and Medicare, Medi-Cal, Obamacare, HMO do not pay. They do not pay us. Okay, and there's no way that we can help you with that. So you gotta expect to take money out of your own pocket to heal yourself. Okay, now if you decided to get the treatment, to invest in yourself, now remember, this is an investment. Why? Because once your body gets better, you can work much more. Once your pain in finger and feet gets better, you are like a brand new person. You can work as much as you want. You can earn as much money as you want. You are a brand new person. So this is an investment. You're investing in the health, your own health. Okay, do not think of an expense. Do not think of that, because it's not an expense. Okay, if you decided to do that, our average treatment time should be around a month to 3 months. Usually around 3 months of time, most patient gets better. Now there are some cases where patient needs more treatment. Or maybe 4 to 6 months, usually 4 to 6 months, okay? For more and more severe chronic. If you're paying for maybe 20, 30 years, maybe 4 to 6 months. Okay, depends. Also depends how many layers of issue, how many problems that you have that's causing all this pain. Depends, okay? But I always tell patients, usually within 1 month of treatment, you are gonna feel some difference, okay? Because everybody, when they come in, they're skeptical. They're asking if nobody can help me, and what do you think I can trust you? I always tell them, give me a try for a month and you'll see. Okay, but I always tell them there's no miracle. Your pain is not gonna heal with 1 treatment or 2 treatment or 3. It's not gonna be completely healed. Okay, there's no miracle. Everything takes time, because it takes time for you to have this kind of pain. You had the pain for what? How many years? 10? 5? 1 treatment, 2, 3 treatments is going to take everything away? No. No way. Okay? Alright, so if you are ready to change your life, if you're ready to invest, if you're ready to be healthy, if you're ready to enjoy life, give us a call. Give us a call. Our phone number is area code 626-281-0510. Okay, or you can email us at wisploin@yahoo.com. This is Dr. Lin. Thank you for watching.